Prince George's County is amongst the top 20 counties that has been afflicted by COVID positive confirmed cases. In the entire country, we're top 20.
Why is that the case? Why is our location the epicenter?
In the public space, suddenly health disparities and health inequities seem to have been discovered. Intensity of the pandemic on top of what is rampant in the community around us has really made the clinical care and certainly the numbers quite intense and certainly defines us as the epicenter.
The biggest challenge for me initially was knowing that coming into work, there is a risk involved. And so we talk about healthcare heroes. And in the beginning, I didn't know if I wanted to be considered a hero.
During this time, it's been a real challenge. Since the beginning, it's been a really scary experience coming to work.
But as you come to work and then you get your first COVID patient, then you never get relaxed, but you learn to deal with it. And you come to work making sure that you're prepared with your armor, your combat, making sure that we have the PPEs.
We're definitely not prioritizing ourselves over the patient, but prioritizing keeping ourselves safe so that we can continue to take care of that patient, but also the next patient and the patient after that.
You see a patient doing well with saturation of between 95 to 100. You leave the room and he's yelling, shortness of breath. You go back to the room, you take the oxygen level is down 88 and you're watching it trending down. You know, it takes a toll on me, especially when I always want to make a difference in my patient's life.
You know, when I look back on the pandemic and how we led our lives, how I led a team, how my unit functions, I want to be considered as a helper.
Our staff have been very good at being adaptable and flexible. We've asked a lot of them over the past few weeks to months as you know, our understanding of this disease process changed and as our volumes changed as well. And so I would say that one of our primary successes has been in their ability to care for these patients.
Well, I'm a recovered COVID patient myself, so I think that was a big success for me.
We had one of our patients that was discharged. We had a sign that said, "I'm a COVID survivor." And we were clapping as he was being wheeled out. He's going home. He's not. One of the ones that's going to the morgue. I'm sorry. But we had an incident where there was a young patient who was 23 and the whole entire night shift was upset because he expired. You know, you don't expect to be 23, coming in with a fever and not making it out of the hospital to go back home to your family.
I cried. Most of our nurses cried. We all there holding each other's arms and try to comfort each other, but it was difficult.
The teams have really come together and to support one another and support the job at hand.
And we don't know when it's going to end. So we just have to keep protecting ourselves, keep praying, and just keep doing what we do, which is caring for people.